Hello and welcome back to another episode of the 2020 podcast, Canada's #1 optometry podcast. I am your host, Dr. Harbir Sayan. Thank you so much for taking the time to join me here to learn and to grow. I always appreciate all the support. As always, real quick favor right off the top, if you get any value out of this episode, please do share it, take a screenshot, put it up on Instagram, tag myself and Steve, or post it on LinkedIn or send a text to your friend. Just let people know that we're having these great conversations. Today's conversation is going to be a very important one. It's a really important topic that's been front of mind for so many clinicians these days, and that is about physician burnout. And there's no better person to speak to about that than my friend, Dr. Steve Vargo. Steve, if you don't know him already, is a practice management consultant with iDoc. He is a multiple-time published author and a sought-after speaker and the host of his own podcast called the I Own a Business podcast. I Own a Business podcast. Thanks again, Steve, for joining me here on the podcast. Appreciate it, man.
Thanks, Harbir, for having me back. And congratulations to you, as we were just talking before we got logged on here. Almost 100 episodes.
Almost.
So we're almost there. I think at Vision Expo, you're going to record the big 100.
That's right. Thank you very much. Thank you. Yeah, I was going to drop that little nugget here, but because these are recorded and they're going to be published later, this will be episode 99 that we're in here. If anything, 99 might be better than 100 because of Wayne Gretzky being the great one. 99 makes you the great one here, Steve. We'll have a special little celebratory episode coming up next for the big 100. So thank you very much, Steve. Well, why don't you give us a quick little intro for, if you wouldn't mind, tell us a little bit about yourself for those who haven't met you or know too much about you.
Yeah, I practiced for years in the Chicago area, and I took a bit of an unusual but interesting path where I stopped practicing about 7 years ago, and I transitioned into the practice management side and joined a group at the time called Prima Eye Group. And we were about a year into that, we were bought by a group called iDoc, who I work with now. So it's rewarding. It's very rewarding, just in a different way. I'm not seeing patients anymore, but I get to work with a lot of different practice owners to guide and give them some of the support they need to operate a successful practice.
Yeah. And your books have been very helpful to me. They're great. So this one definitely I love. Prescribing Change was a great book, and I know you just released a book as an audiobook recently. And then I think tell me a little bit about that so people know where we can find that.
I did go back at request, or I had the question come through enough times, do you have an audiobook? And I got tired of saying no. And even though I don't like the sound of my own voice, people always tell me I've got that FM radio voice. So I put that together and thought, you know what, maybe I can just record it myself, because I auditioned a few people to do it. And when I heard it back, I just thought that is not the way I want it to sound. It just wasn't the way in my head that it should sound. So I recorded it. So I haven't done that one yet. That's a project ahead, but I did one, a couple of my earlier books, Eye on Leadership, and the other one is But I Don't Sell.
Oh yeah.
Which is kind of also a book around how to sell without being salesy, how to have those conversations with patients. So I did make audio versions of those. So that one's still yet to come, but you can certainly get the Kindle or the paperback version on Amazon.
Very good. That's great, man. It's really cool to see that you're expanding into those different areas, because audiobooks are huge. So many people, myself included, I don't listen to audiobooks as much as I used to, but for a couple of years, that's all I did was audiobooks. But your books are great, man. And that what you just mentioned, I don't want to get too off track here because we got a really important topic to talk about, but the selling without selling kind of thing. And that's a really uncomfortable place for optometrists, especially, is that conversation about selling and upselling and things like that. And the first conversation you and I have had, so for those who don't know, Steve was on the podcast about a year ago. And it was about that kind of stuff. It was talking about prescribing change and talking about how to sell and things. So please go back and listen to that. That was actually one of the top episodes of last year. So definitely, clearly people liked it. I think there's a lot of value in that. So please go back and check that one out. So Steve, burnout. I'm hearing this term a lot these days. And is it just me? Is it just now all of a sudden there's a lot of it? Or has it been around for a long time and we hadn't really known what to call it? Like, why is it so prominent right now?
I think it has been around for a long time, but I think it's definitely become something that's grown, that's become more problematic, especially with healthcare professionals. I wish I could remember her name, but there's a doctor that does a lot of speaking on the issue. And it was really listening to hear her speak was the first time that I actually heard the extent of it. And I started doing my own research on it. And what I found is the impact it has not just on the physician and our mental well-being, our physical, our emotional states, but also how it translates into the outcomes we get with patients. And even if we want to go down the road of practice management, ultimately can affect the financial health of the practice. But just some quick stats. Over 50% of physicians, US based physicians, claim to be experiencing burnout. 40% claim to have varying levels of depression. And the suicide rate of physicians is twice that of the general population.
Wow.
So that's staggering. And I think we have to look at that and say something's not working here with the way the healthcare model is set up right now.
Absolutely. And I didn't realize that the suicide rate is double that of the average person, so a non-physician population, and over 50% say that they're suffering some sort of burnout. That's
It's the
incredible.
highest suicide rate of any profession is among physicians.
I'll be interested to see, because of course using the term physician is broad, and there's different forms of physicians within that. I wonder if there's some in there that are dramatically higher than others, and what those might be. But how about in optometry? Do you feel like it's a common condition or common issue that we're dealing with?
I think burnout is, and that's a great question, Harbir. I apologize for not having it in front of me, but you can look that up. And I think there is a breakdown of the different professions.
Oh yeah.
Off the top of my head, I just can't remember what those are.
Yeah, sorry. I
Yeah,
meant to ask: is burnout an issue in optometry, not suicide? That's a heavy topic that maybe is for another time. But yeah, burnout in optometry.
yeah, absolutely. I experienced it. I hear it a lot in my consultations with other doctors as well. I'll give you a quick background on me. Is I did practice for years, and we can go as the discussion moves on into what some of the hallmark signs of burnout are. But I was definitely experiencing some of that. And but I'm a sample size of one. I don't really know when I was practicing what other people are experiencing until I started doing more consulting and working with other doctors. And it's always interesting because nobody ever reaches out to
Hmm.
consulting and
Hmm.
gives you the full reason. It's always typically something that has to do with the business side or practice management. I need to lower my cost of goods. Can you help me hire an office manager or train somebody? It's those sorts of things. But the more the conversation would develop and the more you got to know somebody, perhaps trust starts to develop
Hmm.
a little bit more, and people would start to open up about a lot of the more emotional problems that they're having, and that burnout, that stress that they're experiencing really started to come out. And I thought, wow, this is much more prevalent than I ever thought it was.
Yeah, well, that was actually something else I was going to mention right off the top. Was one, it seems like it's a lot more, it's spoken about a lot more now, but there's likely still so many more people who are maybe embarrassed to talk about it, or just for whatever reason don't want to talk about it, but they are experiencing it, or even those who are experiencing and don't even realize that that's what it is. It says, you said over 50%. I bet you it's like actually quite a bit higher than that even. So what are some of for the person who perhaps is not sure, am I experiencing burnout or what I might be dealing with? From your conversations, what have you learned? What were you able to tease out from those people who initially were like, I just need an office manager, but then you realize that they were actually dealing with burnout, or they came to that conclusion themselves? What are some of the signs of that?
Yeah, and if we look at the hallmark signs that research has actually found, and this is specific to physicians, one of the initial things we'll typically experience when we're burned out. And let me also mention, I think to some degree, we're always going to feel some amount of stress. We're always going to feel
Mhm.
some amount of burnout. Everybody gets depressed once in a while. Everybody has days where they don't feel like going to work. But I think we need to decipher what is normal and where have we hit a point where we need to change something. So one of the initial hallmark signs of burnout is what they call depersonalization,
Hmm.
which is probably the opposite of the reason that we got into healthcare, right? If you were in optometry school, we could go back to that, transport ourselves back to that time when we were just maybe, in optometry school and say, Harbir, why are you here? What do you want to get out of this profession? You'd probably mention something about wanting to make a difference, make an
Hmm.
impact in other people's lives, wanting to help people, not just their vision, their quality of life. And depersonalization is when we lose that, when we stop seeing patients as human beings and we start seeing them as appointment slots or
Mm,
transactions. And then healthcare starts to become much more transactional as opposed to relational. And we lose those connections. So just imagine going to work every day. And a lot of people feel this way. I started to feel this way at some point. You just look at your appointment sheet and you just see a bunch of names on there, but you
mhm.
start to lose that ability to make that connection with people. And we can dig more into this, but once you do that, it affects not only you, but it also affects the patient as well. Because I don't think
Yeah.
you can really be there, be present and be listening and caring and empathetic and compassionate and all those things that requires that connection and that high quality of care, and also the perception that the patient's going to have of you. So it snowballs.
Yeah. We definitely want to get into that because I think there's a lot more, like you said, it snowballs from there. There's a lot more that will result from that lack of connection, that depersonalization. But before we get into that, maybe if you could share some more of the signs, those kind of hallmark signs of the burnout. So first one you mentioned, this absence of human connection or this depersonalization. What would be another one?
So there's three main ones,
Okay.
and the other one or the other two. One is absence of a sense of accomplishment. So again, we put ourselves in a position, and again, these build on each other. So if you're going to work every day and you're unable to connect, and there's a ton of research showing that when we're able to connect with patients, that the adherence to treatment goes up significantly.
Hmm.
And they've done that by surveying patients. So patients who rate their doctors as great listeners, people who are very caring, empathetic, listen to the patient, that their adherence to treatment is upwards of 60% better than when
Wow.
there's not that connection with the physician. So when there's that depersonalization, we're not really building that connection. We're just kind of bouncing from room to room. Again, it's very transactional. So if you look at it through the numbers I just gave you, there's a greater chance that we're not getting the kind of results, kind of outcomes we want with patients. So it's frustrating. And we're not, when you're just talking to patients all day and they're nodding their head,
Hmm.
but they're not going along with your treatment guidance.
Hmm.
So if a patient walks in your door with their glasses broken half, there's a pretty good chance they're going to buy a pair of glasses. And I think that's just something we're used to. But a lot of doctors now are trying to implement more advanced services and more advanced
Yep.
products into the patient experience. But a lot of them at the same time spend a lot of time just talking to patients, sometimes talking at patients,
Hmm.
and the patient doesn't go along with what they'd like the doctor to do. So there's that lack of a sense of accomplishment where you're going to work. Now there's a depersonalization combined with this feeling that I'm not making a difference because my patients aren't agreeing to dry eye therapy, myopia management. They're not buying into these products or services that could help them. The last one would just be emotional or physical exhaustion.
Hmm.
So when you hit a point where you just feel exhausted, what should be meaningful encounters with patients just starts to become exhausting, then that would be another hallmark sign of burnout as well. And again, to some degree, we're always going to have a bad day. But if
Yep.
you're going to work every day and feeling, if that describes normal for you, then you probably hit a point where you really want to sit back and take stock of, am I experiencing a high level of burnout, of consistent burnout? What do I need to change at this point?
Yeah. So I feel like that third one is probably the one that most people would, if you said, what does burnout sound like? It'd probably be something like what you mentioned there, that emotional or physical exhaustion where you're burnt out physically. But there's other signs of that, even if you're not necessarily feeling that exhaustion, that depersonalized. Wow, why is that word so hard to say?
I
Deep
stumbled over it too. So let's not edit it. Let's
depersonalization.
just go with, that's a hard word to say.
Yeah, that one. And then the absence of sense of accomplishment. Yeah, that would be hard to deal with. And it seems like, yeah, they would become sort of this negative cycle at that point, and then you would just start to feel more exhausted because you're not getting the results you'd like to get. But if we could go back to that first one, the one that's hard to say, how does that then affect other aspects of, your work, your business, and things like that?
So, and maybe we could flip this around just to give the opposite scenario. Let's
Hmm.
just imagine a scenario where you were able to make that connection with patients and patients felt heard and understood. And we've all been there. We've all had that experience with a patient. We can all think of at least one and hopefully more where we felt like we really did understand the patient. We listened to the patient felt understood. There was that connection, and the patient really let you know you really made a difference
Mm,
in my life. And I want you to just imagine for a minute how you felt at that moment. You probably didn't feel exhausted. You probably didn't feel stressed or burned out. You had a tremendous sense of connection and a sense of accomplishment with that
mhm,
patient. So
mhm,
a lot of this is really built around how do we change the way we practice? And I might be getting a little off topic here, but I think a lot of times when we think of how do we handle burnout, how do we handle stress, we think of it in terms of what they call escapism. Okay,
mm,
I need to get away. I need to go on. I need to take more vacation days, get away from patient care, exercise more, meditation, whatever your thing is. But I need to get away from it all. Practice fewer days, see fewer patients. So
mhm,
those things can help, especially the exercise, meditation, all those things certainly can help. But what they found is the effects are typically moderate at best because
mm,
it doesn't get into these other areas. You still have to come back from a vacation. And
right.
if this is what you're experiencing at work. So it all filters into how does the practice work. So it's a bit of a transition here. But again, if you're not getting the outcomes, if you're not able to make those connections with patients, you're not able to get the outcomes you want, what does that typically mean for the success of your practice? You're selling more glasses or you're selling fewer glasses?
Right.
More people agreeing to advanced dry eye therapy or fewer? More parents signing up for myopia management or less? More referrals or fewer? So obviously, if you're not getting that, the filter translate into negative outcomes for the financial health of the practice as well.
Yeah, absolutely. Actually, when you put it that way, it does really help frame that whole the mental state that you're in. And actually, in my mind, as you're talking, I'm starting to think about all these different things about neurotransmitters, and you talk about dopamine when you're feeling good and all these kinds of things. Like, you're probably getting a hit of all of that good stuff when those good things are happening. But on the flip side, when you're not getting those good interactions, and you're not
What
making
do you
that
got?
connection, because there's
Cortisol,
that human
adrenaline, all
connection
the bad
releases
things kick in.
all the bad chemicals that we don't want are likely floating around. And I never really thought to put that together. So it's kind of cool to look at it that way. I'm definitely a nerd about that type of thing. But the other thing, actually, if you don't mind me going a little bit off track here, but it reminded me of something that I heard a while back about, you know, somebody said to me, like, what makes you happy right now? Is it thinking about your past? Is it thinking about where you are right now? Or is it thinking about where you're going to be? And my thought was, what makes me happy, or what determines my happiness in the moment, is likely where I am right now. Like, I love having, recording podcasts. I'm pretty happy right now. But like, if I knew the next thing I was going to do after this was to go do something that I really hate doing, it would affect my mood right now and affect my ability to connect with you, Steve. And so, like, if I'm sitting in this room with a patient and I know I hate this job, and then I know the next thing I got to do is go see another patient, I'm likely going to be unhappy now. And in fact, going on that vacation is not going to help, because as the vacation comes to an end, I know I'm going to go back to that same job that I was trying to escape from. So I think it all kind of leads into that, and it becomes a sort of negative cycle. What are some of the you talked about escapism, and perhaps exercise and meditation. We know that helps a lot, but it's not the really the root. It's not the way to really treat the root cause of this issue. How would we get to that root cause? How do, like, that's I feel like a really hard thing to answer, but ultimately we want to help define the problem. We want to help people understand whether they are dealing with this or not, but then how they can remedy this or potentially start to make it better.
I don't think there's one right path. I do think that for a lot of physicians, it's time to rethink how they're practicing, how they're providing patient care. I think we got into this through a lot of the changes in healthcare,
Mm,
administrative, EHR. I don't want to blame EHRs, but I'll just the way we have to practice now
I
is
will.
just different, and we don't have that kind of time to just sit down and interact with patients as much. So I think it's a balancing act for me too, because one of the things that I consult with a lot of practices on is how do we operate efficiently in a way, because a lot of practices in this era that we're in, of especially with vision care plans, will want advice on how do I see more patients. So a lot of discussions I have are around, how do we operate patient care in a way that's perhaps faster, where you could see more patients, but at the same time without compromising clinical care or the patient experience. So I think it brings us back to really sitting down and evaluating, how long does the average doctor, and maybe I'll just ask you this, if you had to pick a certain, how long do you think that on average a doctor spends with each patient in the exam room? And I know that it varies from.
So you want me to, I guess, how long does the average? Okay, 15 minutes.
That's exactly what I would say. So let's just say 15 minutes. And I know there's some that are quicker and
Yeah.
some are longer, but how do you spend that 15 minutes? And I
Mm,
think if you're walking in the exam room and you are taking it as a very transactional experience and doing just a bunch of tests on people, and it becomes
mm,
very mundane and very routine, and you're bouncing from room to room, but you're not really taking that time just to understand, just have a conversation with the
mhm,
patient, make eye contact. Could we change how we practice? And
mm,
that could be through more delegation, it could be through more automation, it could be through having a scribe, but getting to that point, because I don't want the conversation to go, well, we have to see more patients, so you're telling me I
mm,
need to spend longer. No, not necessarily. What I'd like to look at is, if we take that 15 minutes, how can we better use it
mhm,
to get that feeling back that we are making a difference, that if Harbir, if you're my patient, that I get to sit down and we can just have a conversation here, where at the end of that 15 minutes, when you're walking out of the room, you feel good about the experience you got, and I feel good about the experience that I provided.
yeah. And that you use a word in there a couple of times, delegate. That word's come up a lot over the last year or so with different guests that I've spoken to. I did this series of conversations about where's the future of our profession going, and so on. And one of the, when I would ask these, the heads of these organizations, it's people who have hundreds of clinics under their banners. Like, what are they doing? Because obviously they tend to be at the forefront of the technology and stuff, because they want to implement and make their business more efficient. And that term delegation came up a lot. Like, they're saying, well, the doctor is going to be doing less of these tasks. The staff are going to be, or there's going to be technology taking care of these things, or perhaps in a few cases, doctors may have a scribe. But I feel like that's a lot of where our headache or stress levels come from. I got to run these individual tests
Mhm.
by myself. I don't have the time to sit and connect with the patient. But if that's taken care of, that does open up a lot of time for the connection piece,
Yeah.
for
And I
sure.
think that's what you have to do, is open up time, is create time. I actually just did a podcast with Dr. Selena McGee,
Hmm.
and we were talking about dry eye, and in
Hmm.
particular nutritional supplements. And one of the questions I asked her was, how do you find time? Because a lot of times I'll hear with a doctor, especially if they're trying to introduce maybe some kind of specialty care, specialty products, but it's not working. A lot of times what they'll say is, I just wish I had more time, where it's a very busy practice and I'm spending a lot of time just trying to keep up with the routine care,
Hmm.
with the testing and the things I need to do. With the routine care, I don't have time to talk about the dry eye therapy or nutritional supplements or myopia management, whatever else it is. So
Hmm.
I posed that question to her, and her answer really got me thinking again on that efficiency issue, and just how do we change the way that we structure that exam slot, that we have our individual time with the patient. And she mentioned a few things. She goes, I've really had to learn how to be succinct in
Hmm.
communication and focus on what are the most important things that I need to talk about, deciding early what direction is this what direction do I want this exam to go. If it is a direction of, I think this person would benefit from IPL or myopia management, whatever it is, that we start working in that direction, but also being succinct with communication. She mentioned something around, she goes, very rarely am I communicating with the patient but not doing something
Mm.
else. So it's, we were taught in school to sit down and do a long case history. It's just
Hmm.
me and you talking, and then we do a bunch of tests, and then at the end we do our, we come up with our diagnosis, and then we educate the patient. But could we do that while we're doing other things? And she points out, it's a there's an art to it, because you still want to make
Hmm.
that eye contact. So she says it's something she's worked on, but she feels like she's moving and she is talking and educating at the same time, but also a lot of delegation. She goes, I know what I need to discuss in the exam room and where my value's at. There's other things that I might give them in a handout or give them a video to watch. And she says, I put a lot of effort into training the staff so they can
Yeah.
pick up the conversation when I'm done. But let's just call it that, 15 minutes. She feels pretty good at the end of that 15 minutes that she made a difference in the lives of her patients. That's a doctor who enjoys going to work.
Mm-hmm.
That's the difference. Now, does she enjoy every day? Probably not. Does she have her days? Probably, just like everybody else.
Yeah.
She's human. We're all human. However, that's the kind, when I listen to doctors who say, I love my job, almost always, 100 times out of 100, they've figured out a way to construct an exam where they have that kind of time to have that connection with the patient.
Yeah. And, speaking of guests, and by the way, I listened to some of that, and there was something about her getting rid of the patient history or something like that, right? In the beginning of not spending so much time on taking a big history.
Yeah. And I think that's the efficiency conversation is something. There's not a one right way for every practice to do it, but I think it's good for the owners, for the managers to sit down and say, what do we want this to look like for the patient from the minute they walk in the door to the minute they walk out?
Mm-hmm.
And some of that discussion should involve, what do we need to stop doing?
Mm-hmm. That actually leads me to a different question or another question I want to ask you, which I think is so important, and personally feel from my experience that is very relevant to, the feeling of burnout or just unhappiness perhaps in the workplace. And that is like the culture that that offices have, and the different staff, whether it's your office manager or your optical staff, whoever it might be that's involved in the team that you have. In your opinion, you go in to see all these different practices and work with different doctors. How often do you see that work culture affecting the physician's, feelings and the risk of burnout at the end of the day?
It's huge. And I'm glad you brought that up because it's definitely related. Even if you enjoy patient care, but you don't enjoy the people you work with, it's going to be difficult to be happy at work.
Mm-hmm.
So culture is hard. It's one of the hardest things for a business owner, for a manager to create a positive culture anyway, but it's always worth fighting for. So again, if we dig into the research, what the research has shown is that if you don't have good relationships with the people you work with, the risk of burnout skyrockets. So another thing that you should probably look at is, how much of this is on me and just building the kind of culture I want? Do I need to define the core values here and what we're all about? Do I need to rethink how I'm hiring? Where maybe it's not just, and I know it's difficult to hire these days, but maybe it's not just about experience, but what kind of people, what kind of attitudes and attributes and qualities do we want to bring in here once we've defined what kind of culture we have? And does it require to do sometimes the hard decisions of letting somebody go who's just not a good fit? I don't know how many times I've heard this fear of letting somebody go because maybe it was a key position, but then saying afterwards how happy everyone is that person isn't there anymore because they just were not a good fit for the practice. So that's something else you want to look at as well, is the culture and the people who are there every day. That's gonna play a major role in your own happiness with your job.
I couldn't agree more. And I, as I was saying, I know this from my personal experience as a business owner. And as we've grown, when you have one or two staff and you're small, it's easy to kind of manage that and oversee that. When you get to 5 or 6, then okay, one bad apple can really start to affect the overall feeling. When you start to get to 10 or 12, then it's hard because you may have a couple of bad apples, and it's hard to know because some people are good at hiding it and they only, it's just weird. People personalities are just, it's hard to, and so having a good structure and having people who have good responsibilities or understand their responsibilities of taking care of certain things will help you uncover when there are bad apples. And it's really important, as I've learned, to try to pick those out quickly, nip things in the bud as early as you can, even if it seems really hard. Obviously, I've been through the process where I haven't done that early enough, and I've seen the outcomes. And we've done it where we have done it quickly, and it's got a, in my opinion, multiple fold benefit. One is that you've gotten rid of the negativity, that core, from the epicenter. Now that's gone, but staff will see that you are taking the the initiative or doing the thing that they know needs to be done, and you care about how other staff feel at the office, and it breeds a better culture overall. And of course, as the business owner, if you're just even the doctor working in that culture, it's going to help you feel better because everybody else is looking at you as like, as somebody who's looking out for them. So it has it's extremely valuable and very important. And in fact, I was speaking on the podcast recently, Dr. Carly Rose, and she was talking about that and how that's the hardest thing is letting people go. And you always she's like, it's always nice to kind of you'd love to be the leader who like helps somebody flourish, right? You'd love to be the person that someone says, oh, Arbir, he's the one who helped me take it to the next level as a leader. He was amazing. But sometimes you have to be the leader who's the one who's at the person's rock bottom, and you have to be the rock bottom for that person. And that actually is going to be valuable for their life as well. And never really thought about how that is important as well. So sorry, taking totally off on a different tangent, but talking about staffing and HR and stuff has been a really big topic, obviously, these days, as you know. So I'll let you get started. Give any thoughts if you have on that little spiel that I just gave there.
Yeah, no, it's really important. As a leader, it's your responsibility as well to look out for the potential for burnout among the people on your team. Because if you're not creating the right environment, if you're not intentional with that, this doesn't work. Because I think the focus of this talk has mostly been on the burnout of the physician, but from the patient's perspective, they're not the only touch point. It's not that the doctor is the only touch point. There's a lot of touch points. So if you are delivering that high quality care, you're a good listener, the empathy and everything that goes into that, delivering that great patient experience, but your staff is burned out, what kind of experience is that going to be for the patient? I'll share a quick story with you of a chiropractor I used to go to, and I have some lower back issues, and I liked the chiropractor. I thought he was a really nice guy. He always, good listener. He was very, very thorough, but I thought it was odd because every time I was in there, I didn't get that same experience from the staff. The staff could be very short, sometimes kind of rude, and they didn't deliver that same experience. And I actually knew one of the people who work there. Is a girl I'd gone to high school with, and we ran into each other one time. It was the grocery store or something, and we were just making small talk. And I said, yeah, I really like the doctor. And when I mentioned that to her, she looked at me for a second and she indicated something to say what a jerk he was. And I said, well, that's odd. I never got that when I went in there. She goes, no, he's not like that with the patients. He's like that with the staff, which explained to me the kind of experience that I got from the staff. The staff seemed really burned out and stressed out. He wasn't putting in the effort to create the kind of culture that was going to lead to the staff feeling like they needed to feel. So I think it's something that we have to do as leaders and as people who are building the culture in our office, is make sure that we're intentional with building the kind of culture that the staff is going to feel the same things that the doctor needs to feel. Right. Yeah. Once the staff starts to feel that sense of depersonalization, or that sense that we're not making a difference, that sense of emotional exhaustion, then it's downhill. And that's not going to play well with the patient's experience. And it also translates again back to at the end of this is the financial health of the practice.
Absolutely. Yeah. And that's obviously, when we're talking business wise, that's always going to be the bottom line. But that's a really insightful story, actually. And I know I've worked in a clinic like that as an associate. So as a young associate, the staff was going to talk to me more openly than they were going to talk to the business owner. And when I was working, they would, often be telling me, oh my God, doesn't even say hi when he walks in the door. He just goes straight to the back and does his thing. And he doesn't even say bye when he leaves, like barely even talks to us. Whereas I'm, as a young associate, you get a little bit of free time. You go up to the front and you chit chat and you just kind of like the way I was. And I definitely, as great of a doctor as that person was, though, I give him, I still am friends with him. He's great, but we just at that time anyways hadn't made that connection with the staff. And I feel like back then, which now has been a while, obviously, since I graduated, maybe you could get away with that. But right now post-COVID, that's going to be a lot harder for people to get away with, the business owners to get away with not having a good culture, and not giving their staff that attention that they deserve, like you just explained. So a really, really insightful point there. And by the way, for those who are listening, if you're want to learn a little more about how to develop a really cool culture, go back a couple episodes to the episode I did with Kevin Wilhelm from Marketing for ECPs, because they're award-winning company in that regard, and he had some really cool things to share. Sorry, I'm shameless self-promoting on my own platform here. This is terrible. But Steve, to get back to the actual conversation here about burnout, you've talked about it a couple of times already in this conversation. Doctors say, "Oh, I don't have enough time. I don't have enough time." But there was an interesting thing that you shared with me about how much more time do we actually need to take to build that connection with our patients?
It turns out it's not much. And yeah, that's one of the biggest drawbacks. And I do a presentation on this topic, and I save this part for the end because I'll point out that I bet a lot of you are feeling, as we've been talking about this, that you agree with what I'm saying, that we should work toward developing that connection with patients, do a better job of listening, of being empathetic, of working harder to understand what's going on with the patient. But the pushback on that will often be, I don't have time. We're a very busy practice. Yes, I agree. That's why I'm stressed out and burned out. I'm bouncing from one room to the next. That's my life at work. But here's the thing. So when they went and surveyed patients who rated their doctors high on these different scales of being a good listener, being empathetic, someone who they feel took the time to understand them. On average, that doctor spent an additional 56 seconds with the patient. Seconds. A minute. So Crazy. Is it possible that just spending an additional minute, and you could get that minute back somewhere else?
Oh, yeah.
We could do a little bit quicker refraction, maybe. There's maybe one less test we can do. We can learn to be more succinct with our explanations of things. You could get that minute back. But is it possible that just spending an additional minute with a patient could not only significantly impact our own health in terms of less burnout, less stress, but also impact the kind of outcomes that we're getting? Because remember, when the patient feels heard and understood, their likelihood of adhering to treatment recommendations goes up significantly. And all that is going to translate into higher revenues for the practice as well. So
that's incredible.
It doesn't take much longer. If we could just carve out that time. This is what I'm saying. If you want to go on more vacations, go on more vacations. If you're working 5 days a week and you want to cut down patient care to 3 days a week, put that on your list of goals and we'll work toward that. But don't discount the process of how you actually spend your time with the patients. And I've talked to doctors who have done that. In fact, there's a book out there that I've used a lot of research in my presentations. It's called Compassionomics. And that was a doctor. It was an MD that was, by all definitions, burned out. And he turned things around by just spending, I think it was a minute or two at the beginning. He says, I'm just going to give them my full attention and we're just going to have a conversation. I'm going to take that time to be more present, to your point before. We're not worried about the last patient or what's in the next room. I'm just going to be present with the patient. And that translated into enhanced relationships, deeper relationships with the patients he has. And he says over the course of the next days to weeks, he started to feel his sense of burnout just drop significantly.
It's remarkable how much that could help. That human connection is something that definitely, obviously with COVID, we've started to lose it quite a bit. And I think that's part of the deal here. But taking the time to have that connection is really important. It reminded me of two different things here. One is Daryl Glover. What does he say? Everyone's favorite optometrist.
Everyone's favorite optometrist.
I should know by now. Come on. Sorry, Daryl. But DG says that he calls what his 2-minute drill in the beginning. He gives 2 minutes of undivided.
He told me that before too. And that's great. Yep. Yeah. I know exactly what you're talking about.
Yeah. So that's cool. And, obviously he's really good at what he does. But there's another doctor who I really look up to. And that's Dr. Kiran Ramesh in Toronto. And she now does, consulting on this. She talks to people like me. She's kind of in a position like yourself where she's going around talking to ODs and says, look, she's got her connect and direct, or her, she's got this idea of when you walk into the room, you come in with, you clear everything away and you walk in with an open heart and compassion. And your number one job is to connect with that patient before you do anything else. And once you have that sort of this, and it sounds kind of lovey-dovey or whatever. But she's like, once you have like a love kind of for this patient in front of you, then everything else is easy. And definitely I've been working on that. It does almost, again, as silly as it might sound, as hokey as it might sound, sometimes you almost kind of get goosebumps when you're talking to a patient, like, wow, I love, like, I'm so happy to help
Mhm.
you.
That's why I got into
And
this, right?
it's pretty cool. It's pretty special.
Well, and I'll tell you, there's so much negativity in the profession. When
Mm,
I hear from a doctor who said, and we just had our national convention, and we have these call them roundtable sessions where we get in a room with there's maybe 10 to 15 doctors and just sort through a lot of different we talk about a lot of different topics and issues. And
mm,
there was a handful of doctors in the room who were telling their own individual stories about how much I've done it for 20 years. I've done it for 30 years. I absolutely love it. I absolutely love going to
that's
work.
nice.
And when I hear that, it's always 100 times out of 100 when I hear that that is going to be built around the quality of the relationships they have with their patients.
Hmm.
It has almost no factor on money,
Hmm.
because I know some of the doctors, as I got to better understand their practice, some of these practices were very low revenue practices.
Mm,
Some were very high revenue practices. And I've heard this from doctors on both ends and in between, that I absolutely love going to work, but it's always built on the quality of the relationships that they have with their patients.
hmm.
So that is where I would put the focus of my attention. The staffing thing is right up there too. I've
Mm.
never met a doctor who said, I'm having all kinds of problems with my staff. I've never met a doctor who said that and wasn't stressed out. So again, really putting some thought into how we're providing patient care,
Hmm.
not necessarily getting away from it. Again, I'm all 100% supportive. If you're working 5 days a week and you feel like, well, I need to work 3 and my life will, that's fine. Let's work toward that goal. But really putting an emphasis on how we're providing patient care in a way that makes you happy.
Yeah.
But also, again, looking at, especially if you're a leader in the practice, the people that I surround myself with at work every day, are they adding to my happiness, or are they subtracting from my
Right.
happiness, and making some changes, whether it's culture or personnel changes there?
Yeah. I think all of that, going back to something else you were saying earlier, is just being very intentional about all of it, right? I think sometimes we fall into this the routine of it all and just kind of keep going, and next thing you know, yeah, you're burnt out and you have poor staff relations or whatever it might be. But being very, very intentional about it, building that culture, taking the time to have that connection with a patient, because I mean, if you plan to stay in this profession, you're going to be doing this every day for the foreseeable future. You may as well enjoy it. And then you go home. If you have a family, you go home to your family feeling good, and bring that good energy back to them as well.
I will say real quick, the way things are aligned right now in the healthcare profession, it's really not set up for you to be happy.
Mm,
Does that sound bad to say? But I mean, the way managed care is set up,
mm,
the way administratively, regulatory, all the things that we have to do now, if you're not intentional with it, there's a good chance that you are going to fall into that 50+% that feels burned out. So you made a great point, is how do we change what we do have control. Some things we don't have control over, but we have a lot more control than we think we do. How do we take control of our experience that we have when we go to work, both with our patients, with our staff, because that's going to play into the experience that they have as well. So being intentional with it, I would definitely say is something we have to do, because it's probably not the way things are set up right now. Uh, if you weren't intentional, there's a good chance you're going to sooner or later fall into a place where you probably feel that sense of burnout starting to kick in.
yeah, it's really unfortunate that. That was a great hot take, by the way. I'm going to turn that into a clip for social media. That was a good one. Thanks, Steve. But like, the system is set up for not necessarily failure, but it is set up. It's not set up for us to flourish and be happy the way it's
Mhm.
set up, right? For whatever reason, for whoever has the impact on the system has, eventually it's evolved into what it is now. So we have to take the control of it, and do the things absolutely to make ourselves make it so that we can be happy in our own environment for sure. So Steve, to kind of bring it all together, then is there anything that we missed? Any important things about burnout that you've learned that you speak about that we should be sharing with the audience?
Just experiment. I would say maybe set a goal over the next several months, maybe year of what does this need to look like for me to be happier going to work, and experiment with that. Pull your staff together.
Mm,
A lot of times stress, burnout, one of the, we tend to fall into a sense of feeling like I need to do all this on my own,
mhm.
but acknowledge it, and maybe make it clear to your staff as well that, and I think they'll appreciate that I want this to be a more rewarding, happier place for everybody. So let me hear your ideas. What are the things that we could change? What's stressing you out? Because there's a good chance maybe it's stressing all of us out. What are the things that we could start to change? We may not be able to impact everything, but again, that's something that could help you, but it could also build the kind of culture that you want as well. And then just keep tweaking it till you get to a point where, you worked too hard and spent too much money. You took out too many loans to be unhappy. Don't settle for that. I was there. I mean, I know that feeling. I enjoyed aspects of practicing, but there was a point where I had done it for a period of time. My path was odd because I did consulting. Not suggesting other people need to do something completely different, but I had to find my path, which took me into the business side of things, where I had a greater passion for that. But that's not for everybody. So what does that path look like for you, even within clinical care? What are the things that you could change that starts to restore some of that joy that you have for the profession? It's there. You just have to find it.
Absolutely. Absolutely. So I think the key thing is in practice, like you said, is changing the way, eventually evolving, tweaking, having the conversations, changing the way that we practice, and creating the environment that we want to have and the connections that we want to have at work that will make us happy and then reduce the level of burnout. But the other thing, if I could add, is one is the profession of optometry, but so many other professions in this day and age allow us to do lots of different things that are related to our job, like this, for example, a podcast, or go to a conference, or teach a class, or other stuff, or it can be totally different. Like I think of Dr. Danielle Richardson, who's this yoga master and has her own clothing line, all this kind of stuff that makes her super happy. Implementing those and making sure you have those types of creative outlets, or any sort of outlet that can help you stay passionate and keep the juices flowing, I think can be super helpful. Personally, that's been super helpful for me, right? So I love social media. I love this kind of stuff. It's still relevant to work, but it allows me to kind of like change my mindset a little bit. So the clinical doesn't get super boring because I've switch gears to this, and then I can go back to clinical, and everything is still fun. That's my 2 cents on that as well.
Yeah, and it doesn't have to be work related. I will say this too. There are so many opportunities out there that didn't exist when I graduated, even within the industry, to both balance the clinical aspect, or the clinical care, but there's a lot of opportunities now with consulting within industry, speaking. I found that I really had a passion for speaking, for consulting, with working with other doctors, with writing. That's where the books came from. I love that. There was a creative side of me that didn't get a chance to really come out in the exam room. So I found a lot of that. But yeah, are there things within the industry that you would like to do, whether it's some kind of consulting or some kind of speaking? Do you have a unique talent or something unique area of expertise that you could build a brand around that? I mean, we both are doing podcasting, just things like that. Yeah. But even outside of, you made a good point. Outside of the profession, are there things that you could be doing that would bring more joy and reduce some of the burnout? You want to play in a rock band, go dust off the guitar and, do what you want to do. But, in my mind, I keep going back to the profession. The definition of insanity is doing the same thing over and over and expecting a different outcome. So just try something different and see if you feel better. The results will probably come pretty quick. Like the doctor I mentioned before, he said within weeks, he goes, I started to feel that sense of burnout just start to dissipate by just changing a few things, making a few simple adjustments to how I showed up for my patients.
It can be that quick. It really can. That's awesome. Well, thanks, Steve. Any final words? I know you kind of shared a few last thoughts there. Any final words you want to share related, whether it's to burnout or anything else? Where, or maybe perhaps where can people find you and find your podcast?
Yeah, so you can find the pod. If you go to iDoc website, that's idoc.net, you can find out more on the podcast there, along with other things. The podcast is available on most podcast platforms. So I don't, if it's audio, people probably couldn't see what you were doing before, but you pointed to your eye. So I own a business. See what we did there? It's EYE, own a business.
Yeah.
And then my own website, if you want to know more about me, it's either you can typically find me on social media or drstevevargo.com.
Perfect. Amazing. Thank you, Steve, for coming on to share your thoughts and your knowledge on this very important topic. Like I said earlier, is on the forefront of so many people's minds. And thank you to everybody who's tuned in to listen to this. And again, as I mentioned before, if you found any value, please do share it, take a screenshot, put up a link on LinkedIn, wherever it is, and let people know that we're having this conversation. I think there's going to be a lot of information in here that's going to help many of our colleagues who are suffering from burnout and help them kind of get out of that rut. So please do share it with them. Thanks again for tuning in to the 2020 Podcast, Canada's #1 optometry podcast. I'll see you guys in the next 100th episode. I'll see you there. Take care.